through and did a quick demonstration on the types of cryotherapy devices, so we thought we would do just demonstrate an application real quick. In this case, as in always, I always ask the patient, how are you going to be most comfortable? We're going to apply this for 10, 12, 15 minutes, so we want to make sure that you're in as comfortable position as possible. In this case, if we were going to be applying this to her knee, if she had surgery or if she had an injury to the knee, we just finished with therapy. We'll finish up with our treatment through the day with some ice and compression to minimize any inflammation we've created or prolonged or latent swelling or pain. So if we think about the acronym RICE, rest, ice, compression, and elevation, we've got her comfortably positioned. She was fortunate enough, she wore some kind of running tights today, because most of these cryotherapy type applications I don't like to put directly on the skin. One, I just don't like it directly on the skin, contact, I want a little bit of a barrier, and the other one is just for hygiene purposes, because we do use these throughout the day. We take and wipe them down with one of our Lysol wipes as well, but it's always nice just to have a little bit of a barrier there. So I'm going to just gently lift that up and just kind of wrap this. This is a pillowcase, so it's really thin, so it's not going to impede too much of the cold coming through. But again, it just keeps a little bit of a barrier on her, against her skin. So in this case, this wrap here is one specifically made for the knee. So, and they come in different sizes. So we're going to just gently help her lift her leg and just let it relax right on down for me. Good. And we'll slide right up over the knee, come right over and close. And I want to kind of wrap it fairly tight. Again, the nice thing about this is that it's going to circulate cold water, which the Game Ready devices are nice because you can adjust the temperature. Some people are a little more sensitive to cold, so they don't want it so cold. Some people want it as cold as you can get it. So this one has a little bit of a temperature adjustment, and it also has a compression adjustments. So if they have a lot more swelling, we can make the compression a lot tighter. And again, some people don't tolerate that very well. They're a little more sensitive. So once everything is on, the settings on the machine are right down here. We would turn the machine on. It will set up. It's already set to run for 15 minutes. It's set at a low compression, and once we start the machine, you will see the temperature gauge down here in the bottom. Once it starts circulating, the temperature will start to drop. And you should start to feel cool. And then you're going to start to feel compression. So again, patient is comfortably positioned. We now have rest. We have ice, we have compression, we have elevation. So we've maximized our benefit from that standpoint, and we'll let her comfortably rest for the next 15 minutes.